It's been a pleasure to work with Laura Allender through this process, really. She received her BSN in 1977 from Illinois Wesleyan University, an MS in Community Services from Michigan State University in Okinawa. And she currently works at a Lakewood Senior Living in Clayton as a manager in policy and training. I think she describes her career best. She really has worked almost every spectrum in nursing, labor and delivery, and now the last a few jobs have been in gerontology. So, well,
thank you. So, my topic, culturally competent care, there's a mouthful, right, of the aging LGBT population. Cultural competence it's been a buzzword in nursing care for quite a while now, but I sort of have a different perspective on it. Aging, that's a big deal nowadays. We all hear stuff in the news about how the population is aging. You don't hear very much about aging LGBT, and I think it's a real important thing to, I think it's an important topic. So here's why I'm here today. My husband, who talked me into taking my first graduate school class 20 years ago when we first met, and my two brothers, Michael, that's Michael, and his partner Ed, and they've been married for at least 15 years, maybe longer. And then my other brother is Eric, and his partner Jim, and their daughter Savannah. And Eric and Jim have been married for close to 30 years. And Jim is in the last stages of his life right now with cancer. So they're facing some of those same issues. So those are the people that inspired me to talk about this particular topic. So just as an overview of what we're going to talk about, the U.S. population, how it's aging, what percentage is LGBT, what healthcare providers' attitudes are, and their perception of the LGBT community. And then the flip side of that, what are the LGBT community perceptions, experiences, and fears related to healthcare? Then what special considerations does the aging LGBT population have? The theoretical framework that I use to look at all of this, and then finally application to nursing education and practice. This is something that shouldn't just be focused in the academic setting. This is a topic that needs to be out there throughout all healthcare settings. So the population is getting older. These are from the U.S. Census Bureau comparing the percentages of population in each age group in the 2000 census and in the 2010 census. And you can see which groups grew and which groups didn't grow. The young group grew a little bit. The second group, 18 to 44, that barely grew at all. But then look at the 45 to 64, 31% growth in that group of population. And then the oldest group, 65 and over, grew by 15% in 10 years. So it all goes back to that whole baby boomer thing. You know, the baby boomers are getting older, and I'm right there with them. So this is just sort of a different way to look at that information, and it presents the gradually expanding group of older and the shrinking group of younger population, and also the change in the median age, which doesn't look like that much when you just see it on a chart, but when you put it out into practice to see where the main population is, it's pretty astonishing. Calculating the LGBT population is really, really tough. It's tough to get accurate numbers because older people may have never come out, or they may have come out and they're back into the closet now. And there's a lot of reasons for that. And then who the heck do we include? Have you even heard of all of these? Because I'll tell you what, when I started doing some research, some of these I had never heard of. Used to be LGBT was the only abbreviation. Now you can expand it, LGBTQIQT, on and on. So that's why I just kind of narrowed it down to LGBT. That's easier to talk about. So various sources quote different percentages. The lowest percentage that I saw anywhere was 1%, and I don't think that's accurate, personally. The highest was 10%. That number generally comes from the LGBT community, so we maybe should be paying a little bit of attention to that because they know more about who's in their community than we do. The Gallup survey that was done, and it was across the states. It wasn't a huge group of people, but it was a broad group. And they calculated the rates of LGBT in each state and in the District of Columbia. The lowest was 1.7% in North Dakota, probably not a surprise to anybody, and 10% was the high in Washington, D.C. So if you extrapolate, based on that national average of 3.5, and the numbers in the 2010 population, what you come out with right now, or actually in 2010, the 45 to 64 age group is 2,852,130. And the 65 and older group is about 1.5 million. That's a lot of people out there that nobody's talking about. That's why it needs to be part of education. So healthcare providers. The first thing you have to think about is that healthcare providers are just a subset of the population. So there's healthcare providers that have a good attitude, an accepting attitude, an open attitude, and then there's the flip side of that. Then you think about the history. Until the 1970s, it was officially a mental illness to be gay. It didn't come out of the DSM until 1973. So that's a long history of people being looked at as crazy. The DoD, the Department of Defense, is a really good sort of small picture of how that's worked. So historically, if you were found to be a homosexual, you were kicked out of the military immediately because you weren't safe, you were a security risk, you might attack your fellow soldiers and try and do terrible things to them. Of course, we know that's really pretty silly. Then the next step in the process was don't ask, don't tell. That was during Bill Clinton's presidency, so in the 80s. Then the next step in that was the repeal of don't ask, don't tell, which was a good step, but it didn't really accomplish a lot except to set people on the pathway. The actual full recognition and acceptance of the LGBT population and sharing of benefits with them the same way as heterosexuals didn't come until last year. So that's a long history of not being treated very well. So heterosexism and homophobia, those are the two big things that you have to think about. Heterosexism is basically saying that none of that stuff is okay. The only thing that's okay, the right way to be, is a heterosexual. The only proper way to be is a heterosexual. And homophobia is being afraid of, or being afraid of the influence of homosexuals, homosexuality. I love this picture. Homophobia, insecurity about being a heterosexual. kind of cute, don't you think? So the literature. This was a big surprise to me. The literature talked a lot about the attitudes of heterosexual healthcare practitioners towards their LGBT fellow professionals and towards their patients. I guess because of my family history, I have a lot different perspective on things. I was astonished to find out the terrible things that happen to LGBT medical providers. Terrible things. People being outed when they didn't really want to come out. People being harassed by having somebody say a terrible thing and then, oh, you know I'm kidding, right? So sneaky things like that, things that are hard to pin down, all the way to outright getting people kicked out of their jobs. I was just blown away. I've never seen that, but it happens. And if you have those healthcare professionals that are willing to harass their fellow professionals, think about how that's perceived by those patients, and think what kind of attitude they're carrying over to their patients. They're making their patients afraid. Now the good news is that 73% of healthcare professionals describe their workplace as LGBT friendly. Well, maybe that's good news. Maybe it's not. Maybe people are just ignorant like I was and think everything's good out there and don't really see what's happening. But there's this organization, the Human Rights Campaign, and their whole focus is to help healthcare facilities become appropriate, have appropriate policies for patients, appropriate policies for employees, and to train their staff. So they do a survey every year, the Healthcare Equality Index, and between 2012 and 2013, there was a 153% increase in participation in this program that they have. There were 718 facilities that were rated in this Healthcare Equality Index. And of the VA system, which you know about, 120 out of a total of 152 VA facilities participated. I think that's a really good sign. Non-discrimination policies have been created in all of those facilities. They tend to be in the 90% of those rated facilities that have equality towards gay and lesbian employees and gay and lesbian patients. So like a visitation policy. It doesn't matter who your partner is, what gender your partner is, they're still your partner. And they have the same visitation rights as a heterosexual couple. So in the 90%, they're coming up with those policies and they're putting them into practice. So that's a pretty good sign, I think. Nurse educators. This is good and not so good. 78.6% of nurse educators think this is a really important topic to talk about. But only 28% of them feel like they're able to teach the topic, feel that they have enough knowledge to share it with their students. 56% say they're not at all prepared. So there's a big gap in there. There's a lot of room for improvement. So LGBT perceptions now. What do they have to deal with? They have to deal with institutional bias. Forms that don't give you an option, except male and female. Forms that don't give you an option to choose any other kind of gender identity or sexuality. The invisibility that they feel because nobody recognizes, lots of medical professionals don't even consider it a possibility that their patient might be something other than heterosexual. I mean, think about it. How often have you interacted with somebody and it just never crossed your mind? You just assumed, because, you know, we all are pretty good at that. And then they have a big problem with decreased income and lack of insurance. Now, hopefully, the Affordable Care Act is going to help that last part, but lots of these population can't access health care. And then what that leads to is they don't get the appropriate preventative treatment, and they end up with worse chronic illness, and it's harder to manage. And they're already afraid to go to the doctor because they don't know how they're going to treat it. So they're kind of working at a disadvantage. All the stereotyping that anybody can do, but we're thinking about healthcare professionals here, those stereotypical thoughts lead to discrimination, to disrespect, to harassment, outright harassment, hostility, neglect, refusal to treat somebody. That just blew my mind, but it happens. Healthcare providers will refuse to provide treatment for somebody that is not heterosexual. Providers are not knowledgeable about what that population needs. And in all the literature, the group within the LGBT population that's most affected by that is the transgender population. Medical providers do not know what those people's needs are. Partly because their numbers aren't that high, and partly because people just don't talk about it. So it all boils down to this population is afraid. They're afraid to come in and see their doctor. They're afraid to go into a hospital if they're ill. They're afraid to go into a nursing home as they age. The challenges that the older group faces in particular, well, of course, ageism. Ageism is across the board for anybody that's over, I don't know, what, 40 you think? Lots of these folks have lost their family relationships. My brother-in-law, Jim, his family, until he was diagnosed with cancer, his family hadn't talked to him for 20 years. He has a twin brother that never talked to him. Horrible. People have lost their jobs. My other brother-in-law, he never came out in his whole entire career. He retired last year. Nobody that he worked with knew that he was a homosexual because he was afraid. Years and years and years of heterosexism and homophobia have beaten down this population so that people who were out of the closet go back into the closet when they go into any kind of a care facility or need home health care, because they're afraid. They're afraid of what might happen. And again, undertreated and untreated chronic medical conditions means that this group of people may have an even higher need for the care that they're afraid to seek. They're a lot more likely to live alone, and they're much less likely to have kids or grandkids that are going to help them. There aren't very many resources. There's more than there used to be, but there aren't very many community resources. The amount of housing for aging LGBT that's specific to them or openly friendly to them is just so small. It's just such a tiny percentage. So Madeline Leininger's theory of culture, care, and diversity, this is where I started because she was sort of the leading edge of culturally competent care. And her theory says that transcultural nursing is a formal area of study, and it's focused on comparative analysis, on culture care, in other words, what kind of care you're used to getting in your culture, health and illness beliefs, values, and practices.